Hi everyone, my name is Daliya Ignatius and today I'll be giving you a brief presentation on my master's research project, which is on the investigation of the effect of applying SEMAR filter to CT scans of patients with metal implants on the accuracy of radiotherapy treatment planning. My supervisors are Dr. Mounir Ibrahim, Associate Professor Mahsheed Sabet, Mr. Zaid Alkhatib, Mr. Talat Mahmood, Dr. Pejman, Rowshan, Farzad, and Simon Goodall from Genesis Care. So that's a big list of people from ICON, Genesis Care, Hospital, and UWA, but thanks all the supervisors. So just to give a quick introduction, what I'll be doing in this project is basically analyzing CT images of patients with metal implants that are processed with and without SEMAR algorithm, which is a metal artifact reduction algorithm, and then looking at the dose calculation accuracy of those images. And here is a grand chart of my project, which is expected, fingers crossed, in a year from now. And highlighted is what I'm doing right now. So moving on, a quick introduction. So why is imaging important in radiation therapy? So in external beam radiotherapy treatment planning, imaging plays a crucial part. And as we can see in this image here, CT imaging takes up a quarter of the full process, and that is because it allows for the positioning and delineation of tumor. It also identifies any surrounding tissues and organs at risk. And as you know, CT imaging is a type of X-ray modality, and the imaging is dependent upon X-rays that are passing through the issues. And we encounter an issue when people with metal implants are imaged. And metal implants are very common, as we can see in these images here, and they're usually made of titanium or stainless steel, which are of high density and high atomic number. They can severely attenuate the X-ray beams as they pass through those metal implants, resulting in these metal artifacts. So as we can see here, these are the bright and dark streak artifacts that result, and here are two non-enhanced cerebral CT images of two patients after endovascular coil embolization. And so these bright and dark streak artifacts result from photon starvation, beam hardening, and scatter and motion of the metal. So they also result in incomplete projection data and subsequent reconstruction artifacts. So to reduce these metal artifacts, we use an algorithm called metal artifact reduction algorithm, and at this hospital here, we use SEMAR. So that's what I'll be using in my project. So single energy metal artifact reduction, or SEMAR, is a raw database correction method. It uses single energy, giving it an advantage over dual energy or mega voltage CT. It can detect and segment corruption projection data corresponding to metal implants, and the corrupted data are then modified by replacing them with the estimates of corrected values. And SEMAR uses iterative reconstruction technique, i.e. repetitive forward and backward projection between the image and projection data spaces. And here is a flowchart of the entire process, but I won't go deep into the algorithm because I'll be just using SEMAR as a filter, just like how we use Snapchat or Instagram filter nowadays. So moving on, here are two videos that I've added in just for your benefit, so you can appreciate how SEMAR really plays. So on the left here, it's a CT slices without SEMAR processing, and the right, it's CT slices with SEMAR processing, and you can see how much it reduces these bright and dark streak artifacts. So moving on, some of the benefits of SEMAR. So it can be easily implemented into the workflow, and reconstruction can be performed clinically within clinically reasonable times. The filter can be applied to data during the scan or retrospectively in raw data. And reconstructions run automatically with no additional operator input required if we set it in the scan protocol. And symbol acquisition protocols can lower radiation exposure, and accurate dose distribution can be generated without providing any additional dose to the patient. So the significance of this research. Currently, SEMAR is used as a reviewing tool for contouring both targets and critical structures in radiation therapy treatment planning. And the artifact currently is being forced to have a density of soft tissue, which may not actually be an accurate method to deal with these artifacts. And it is quite a rough method, especially when dealing with large metal implants, especially in the case of bilateral hip implants, because then the PTB will be too close to the metal. And also, the company that owns SEMAR or produces SEMAR, Toshiba America Medical Systems, does not recommend the use of SEMAR in SEMAR-corrected images for treatment planning. So what I'll be doing is that if SEMAR can be deemed fit for using RT treatment planning, then the images can be used in dose calculation, which can both save time and associated cost. It can also increase the physician's confidence in organ and tumor delineation and also in the planned dose. So, the theory behind it is that CT numbers are used to determine electron densities, which are the most important quantity for CT-based treatment planning of RT. And any incorrect assignments of these electron density values can result in errors in dose calculation. And because dosimetric accuracy directly depends on the CT value, any improvements in the CT value of the artifact is expected to have an improvement in the dose calculation accuracy. And so that's like a hypothesis, and this is my aim. So what I'll be aiming is to assess the improvement in CT number accuracy, dose calculation accuracy, and its effects on treatment planning accuracy using semi-processed and unprocessed images on the using the planning system. So moving on to some of the publications, there are numerous papers out there that look at the diagnostic imaging side of SEMAR, and all of them have proven that SEMAR is good at producing more accurate image quality. But there are only 3 papers out there in terms of radiation oncology, i.e. the dosimetric accuracy of SEMAR. And so these 3 papers here, the first one's on external beam radiotherapy, second one by Mickey et al. Is carbon ion radiotherapy, and the third one looked at internal radiotherapy, especially prostate brachytherapy. So they all looked at metal inserts, metal screws or metal implants, and Shirashi et al. Paper had 40 patient data. This one had head fandom and 2 patient data, and the Murasaki et al. Paper only had an electron density fandom which replicated hip implants. And this will be the paper that I'll be closely working towards, because mine will be very similar in the sense that I'll be using external beam radiotherapy, but I'll have fandom, like multiple fandoms possibly, and patient data as well. And the findings is that the Murasaki paper only observed improvements in CT number accuracy for bilateral head case and none for the unilateral implant case for any irradiation method used. So that'll be something that I can improve on as well, possibly. So as I said, I'll have, in terms of the method and analysis, I'll have a fandom study and a retrospective patient study. So for the fandom study, I'll scan the fandom multiple times with and without the metal insert to obtain, to quantify the repeatability of the CT number for an unchanged phantom. And for the patient study, we'll obtain the data from Charles Gardner Hospital or other clinics, and the patient, and so basically what I'm looking for is patient data or CT scans before and after the metal implantation, so that we can better analyze the dosimetric accuracy. And in terms of CT number accuracy, we will scan the phantom with and without the metal inserts, and multiple CT slices of the current region of the phantom will be selected. The HU values will then be calculated. Mean HU values and image noise will be calculated while keeping all the contours the same. And then, so we'll end up with these 3 sets of data. So one will be the reference with no metal implants, and the second one will be SEMAR unprocessed. Third will be SEMAR processed, and we'll use these equations here and also other statistical analysis. And then following, the last step would be dose calculation accuracy. So we'll perform a quantitative dosimetric evaluation using VMAT, and the dose calculations will be performed using Eclipse treatment planning system. And the treatment plan will be created for the reference data. Using the same geometry and monitor units, the treatment plan will be recalculated for the data with metal implants, and a 2-dimensional gamma analysis will be performed at the very end. So here's my research plan. So first step is research proposal, which will be done now. And then next would be fandom study, which I've already collected some data on for one of the fandoms. And afterwards, I'll do the patient study, depending upon ethics approval and everything. And then will be analysis and following final report. So here, this will be my second last slide. And here is a 3D printed, in-house 3D printed spine fandom by Simon Goodall. Thanks, Simon. And so here is a spine fandom with no metal screws. Here is a same one with titanium screws inserted. And this is with carbon fiber screws with titanium coils around it. So me and Zaid CT scanned the phantom, and we have semi-processed it, but haven't done the dose calculation or analysis yet on these ones. And after I do that, I'll be moving on to this electron density phantom, which has 16 rod-shaped tissue substitutes and also metal rods that I can change and analyze as well. So that's basically it, and these are my references for this proposal. And any questions?
You mentioned that you're going to be doing some other statistical analysis in addition to what you mentioned today.
Oh, it depends. It depends how, because I've seen some analysis on some of the papers that I read. So Wilcoxon analysis and things like that. So if that is needed, then I will perform those ones on top of this. So yeah.
Yes, David has got a question. David?
Yes, David.
Do you know what is the underlying algorithm behind this SEMAR? Is it based on some very clever mathematics, or is it simple to understand?
It has some clever mathematics. I looked into it, but then it was a bit too complicated, and it was just too complicated to show in this presentation as well. That's why I excluded it, but did include this sort of flow chart that shows it in diagrams, what the algorithm does. But yeah. Yeah.
So whether there is another way to reduce this metal artifacts, some other methods,
Yeah.
rather than using these mathematical methods. You probably remember Ibrahim's project, so metal artifact reduction,
Yep.
noise reduction. You use machine learning as well.
Yeah.
Questions?
Yep.
So thanks for the presentation, it's really clear.
Thank you.
I just had a question about when you do the dose calculation
Mhm.
on the SEMAR CTs,
Yep.
the SEMAR corrected CTs,
Mhm.
are you going to compare that against the non-SEMAR corrected